Today's topic is going to be about problems as a result of immobility or limited mobility that patients might experience. Hi, I'm Kathy Getrust, and I'm an instructor in community health. The importance of activity has been well known for a long time, but there has been such an increase in focus on the importance of exercise and activity in our society in the last few years. Newspapers, magazines, and books address the issue. Exercise videos and programs are everywhere. Health spas and physical fitness centers are doing big business of attracting people who want to exercise. Never has there been so much emphasis on staying active. Exercise and activity are very necessary for a healthy mind and body. They're holistic measures. Holistic means that it helps benefit the whole person. Physical activity improves functions of the entire body's systems. Some of the benefits of exercise and activity include an increase in muscle tone and strength, maintenance of body flexibility and coordination, improved respiratory function, prevention of pooling of fluid in the lungs, improved circulation, a strengthened immune system, and research suggests that a healthier immune system aids in our ability to fight off infection and other diseases. Benefits of exercise also include the maintenance of healthy skin. It promotes effective elimination, improves appetite and fluid intake, aids in the digestion of food, increases mental alertness, and also relieves stress. With this impressive short list, I will add, of benefits to being active, what might be some of the factors that are limiting the ability of patients to move? Lifestyle is one important factor. Some people just like to be more active than others do. Some engage in sports and other outdoor activities, while others prefer to read, watch TV, play board games, or participate in other activities that has more limited movement. Energy is another factor that influences our ability to move. Some people have low energy levels due to sleep disorders, disease, or possibly mental illnesses such as depression. Age is also a factor. It's no secret, I'm sure, to any one of you that as we age, we tend to slow down. The more strenuous sports like skateboarding, hockey, football get traded in for the more sedentary ones. Disabilities also influence our ability to move. Conditions such as cerebral palsy, muscular dystrophy, or other diseases that cause disabilities prevents the person from being as active as they would like to be. Fear also influences our ability to move. Many people, especially the elderly, are afraid that an increase in activity might cause them to fall. A fall for elderly people frequently means a fractured hip or other type of fracture. It's not at all uncommon to hear elderly people being admonished that maybe they better limit their activity to prevent falling. Pain is a very important factor in our ability to move. It limits our willingness to move. Diseases such as rheumatoid arthritis cause much joint and muscle pain with every single move, and as a result, people are reluctant to move as a result. Surgical patients with large incisions are reluctant to move because of the pain experienced when that happens. There are different types of immobility that I would like to talk about. The first one is called voluntary immobility. That type of immobility has always been something that's been difficult for me to accept. This is when people choose to be sedentary simply because they want to. My father comes to mind with this kind of immobility. He's an elderly gentleman who was capable or is capable of walking, but chooses not to, simply because he doesn't want to. He sits in his recliner chair watching television a great deal of the time. He enjoys going for rides in the car, but it's not something that he would choose to do if he was required to exercise and walk. He knows the importance of exercise activity. I and other health professionals have made it very clear to him some of the complications that can happen as a result of his immobility, but he continues to choose not to. This is something that I have had to come to terms with, to accept his choice to not engage in much physical activity. Another type of immobility is for purposeful or therapeutic reasons. Examples for limiting or restricting movement might be if the patient has a cast on their limb. Limited mobility would be to heal and repair the bone underneath. Limited mobility also might be ordered for a patient who has had a heart attack, allowing the heart muscle that has been damaged to repair itself. Patients with emphysema become very short of breath on any strenuous exertion. So they will be required to pace their activity and limit strenuous activity. Also, patients with various forms of arthritis also need to pace their activities to prevent joint damage and deformities. I'd like to have you know the difference between the terms bed rest and complete bed rest. There's a significant difference between those two terms. Bed rest means that the patient stays in bed for most of the time, but usually the term is accompanied with some limited mobility, such as the physician might order bed rest with commode privileges or bed rest with bathroom privileges. Complete bed rest, as the name implies, means exactly that, complete bed rest. If the physician has ordered complete bed rest for your patient, that means that that individual may not get out of bed for any reason. There's also unavoidable immobility. Situations when a patient is not able to move freely for various reasons. Some examples of unavoidable situations for immobility might be paralysis of some or all of the extremities due to nerve damage. Examples that come to mind might be someone who has had a stroke, an accident due to a diving or motorcycle accident, multiple sclerosis, or other disease that damages the nerves. Terms that refer to types of paralysis are paraplegia. Paraplegia means paralysis of the lower half of the body. Usually it includes the abdomen